and welcome to this episode of our video podcast series, Healing Healthcare, How Industry Changemakers Are Improving Healthcare. I'm Shante Wilson, a Vice President with Reed Associates, and I will be your host today. Joining me is Percy Howard, President and CEO of the California Institute for Behavioral Health Solutions. Percy, thank you for speaking with us today. I'm looking forward to our conversation. Before we dive in, would you mind introducing yourself and your organization?
Sure. And Shanti, thank you so much for inviting us to have this conversation. Much appreciated. A little bit about CIBHS. Actually, I'll start off and I'll just say a little bit about myself. I'm Percy Howard. Again, I'm the president and CEO of the California Institute for Behavioral Health Solutions, and I've been in that role for the past 6 years. But I'm a little bit of an elder in the field. I've been working in the field of human services and behavioral health, et cetera, since 1983 when I moved to California. I've worked in a variety of settings in people-serving organizations, from my first job when I arrived in California after graduate school as a case manager for Big Brothers and Big Sisters of the Greater Sacramento area, to being a clinical director, for a large CBO. I worked for Sacramento County Child Protective Services for 14 years, which is the longest tenure I've worked at an organization besides CIMH, because we used to be called the California Institute for Mental Health. Now we are CIBHS. But I started 15 years ago at CIMH. I've also worked in hospital settings. I've worked in juvenile justice treatment settings. I was a therapist. I'm an LCSW. I was a therapist at the Warren E. Thornton Youth Center, which at the time that it's since been shuttered, but it was a pretty innovative treatment program that was ancillary to the Sacramento County Juvenile Hall. So, like as I said, for the last 15 years, I've been with CIBHS. I came into CIBHS as a senior associate, running a large person-centered care treatment planning project in several different counties in California. Progressed up, through the ranks in the organization, became vice president in 2017 and CEO in 2019. So, Shanti, that's kind of the short version of my career journey.
Thank you so much. I appreciate that, Percy. That's a wealth of great experience. So your organization has been working with many counties across California to really knit together equity and behavioral health interventions. Can you tell us more about the work you're doing?
Yeah. We have long, since 1993, CIMH/CIBHS has been in existence since 1993. And from the beginning, our philosophy about equity has been to not completely carve out equity efforts, but to integrate them completely in whatever clinical practice improvement, operational, system support projects that we've been involved in. We've always felt that things like community co-design, were important principles to be able to adhere to, when we're trying to bring equity into a project. We've always felt that you can't, engage a government entity in a vacuum, separate and apart from the needs, desires, and views of the community in which they serve, and expect to get positive, lasting outcomes and results. So, we sort of like to say, internally, we say that the work that we do, really is beyond cultural competency. We're looking for integration, and we're looking for partnership. We're looking for the governmental organizations that we work with to become more sensitive and more attuned to the needs of communities after we work with them, and not to view the interventions that we work on with communities and the government entities, as being static, as being just, related to a project, but that they end up picking up a history of their own over time, and people are learning new ways to be able to partner. So the other thing I think is important about our equity approach is that, when we're talking about equity, we're talking about equity for all. We're talking about, all of the communities and people with disparate behavioral health needs being able to receive the help they need in the context that they need. This is not, at the exclusion of any one group to the, inclusion. Inclusion means inclusion. It means that, everybody that we're working with, we have the opportunity to work with them towards solutions that are lasting and that can have impact. That's why we don't just do evidence-based practice implementation, at which we are pioneers, having brought a range of evidence-based practices into California in the early 2000s. But we are also heavily involved in community-defined evidence practice implementation, because those practices are built in communities. Those practices are maintained in communities and focused on the need of specific communities. And then now we're working with some of the developers of these CDEPs to migrate these practices and the impact of them into other communities of similar need. So, our equity approach is, again, I'll just put a punctuation mark on the fact that it's long been very inclusive and, built more on a process of saturation than sort of culling out that equity need.
Thank you so much, Percy. And you mentioned integration and partnership, which I think are so integral. And I think we're really lucky in California that health equity continues to be a focus in our current environment. What are your thoughts on how to continue and expand this work in a meaningful way to address the biggest issues that are causing the equity gaps?
Well, I want to echo your opinion about how fortunate we are to be in California, to where there isn't a wholesale desire to abandon equity. Of course, there's pockets of that, and that's to be expected given the current political environment. But I think, considering the equity gap, one of the things that we have to really work on is continuing to empower communities to be able to support themselves. So, more equity projects that leave behind expertise to be able to convene people around a set of needs, that leave behind expertise in being able to implement these CDEPs I was talking about, for instance. I think the focus on developing and disseminating community-defined evidence-based practices in behavioral health is going to be a critical need. The Child Youth Behavioral Health Initiative project, of which CIBHS, we are the third-party administrator for the CDEP, in CDEP/EBP implementation component of the project. It's a $421 million investment in practice dissemination. I think it's critical that the CDEP component of this type of work is elevated to be alongside, if not in front of, in many instances, the EBP work, because of the resonance and the impact it can have with communities. And the fact that communities can take increasing amounts of responsibility to learn how to implement and sustain and to sort of feed the evolution of these practices in their community. Again, I'll stress, helping people help themselves is going to become increasingly more important than simply organizations like ours coming in with our expertise, doing something, and then coming back again and again and again. We need to leave behind more competence for implementation regarding equity initiatives.
Absolutely. I really love the thought of empowering communities to support themselves. And for those working in sort of the area that you're really specialized in is combining equity with behavioral health, what action or advice would you share with others to continue to move that forward?
Well, I think one of the things that I would stress is systems change and practice change have to go hand in hand. We have had the CYBHI is an amazing example of Governor Newsom and the legislature making a priority of not just making a policy change that changes the business of how we do things or the structure of how we do things, the sequence of how things happen, but for the first time and the biggest investment in the history of the United States, has paired together a practice improvement component with a system redesign component, to create opportunities for people in some of our most challenged, communities. That project is a $4.4 billion investment. The part that we're running, like I said before, was a $421 million investment, but no time ever in the history of the United States as a practice improvement. So, because at its core, it's not just a policy implementation project, it's a practice improvement, equity involved project. Never has there been anything this big, in the history of the United States. No state's done anything of this nature. New York is primed. We'll see what happens, money-wise, because of the political environment. But the state of New York is primed to do something very similar within the next 2 years. But, marrying together really effective policy with opportunities to foment practice change, that's the thing. I mean, you can have the most elegant policy in the world, okay? But if you don't have mechanisms, tools, strategies, and funding in place for practitioners on the ground to be more effective and to be able to offer something within communities that's not just resonant, but impactful, then you're not going to go anywhere. So we're hopeful that in California, we continue to work this way. And you can see more of it coming down the pike. You look at BH Connect, BH Connect, the new 1115 waiver, again, has a strong practice component, that's involved in it. There are several core evidence-based practices for children and adults that are embedded in it, with the sort of grantee funding process. Counties, CBOs, et cetera, will be able to train their staff for free for the length of time of the waiver. That's new. In the past, we would create the policy imperative and then say, you kind of figure out how to get the training part. But the training part and the implementation support part of this is going to be embedded in BH Connect. So to me, that shows a certain amount of momentum moving in the direction of what I've been saying. Effective policy, practice change on the ground, supportive mechanism coming from the state or large government entities that are involved to make sure that there is more opportunity. And when there's more opportunity, hence there's more potential to create equity, in this, not just in the strategy, but in the impact of it.
Absolutely. I'm so glad to hear the investment and the partnership across the continuum, and that you guys are starting to gather those lessons learned and making it really impactful, and maybe other states like New York can learn.
Mhm.
Percy, it has been a pleasure speaking with you today. Thank you for sharing your insights and experience with us. Is there anything else you'd like to share?
No, well, yeah, one small thing. These difficult times, they're difficult times. Take care of yourself, take care of the people that you love, keep your blood pressure down, focus on, the things that you can actually do every day to create more impact. We're fortunate, those of us who work in behavioral health and work in the people serving fields, we're very fortunate to get up out of our beds every day and know that we're going to do work that is impactful, supportive of people, is loving, caring, and kind. And so remember that.
Thank you so much, Percy. We look forward to following the great work that you and the California Institute for Behavioral Health Solutions are doing. For more information, please visit cibhs.org. And don't forget to check out more episodes of Healing Healthcare, a video podcast series hosted by Freed Associates, as we uncover how industry changemakers like Percy Howard are improving healthcare. Follow us on LinkedIn for industry updates from our team of healthcare professionals. Thank you for joining us and have a healthy day.